Are you suffering with chronic neck pain, chronic pain between the shoulder blades, chronic low back pain, sciatica, or any chronic musculoskeletal condition? If you are, you're probably taking daily anti-inflammatory medication and painkillers because that's the way you've been trained. And I understand why you're taking that, because it's not fun to be in pain. But you know what it's like? It's like driving your car down the street and your oil light comes on to change your oil. Instead of changing your oil, you go and you cut the electrical to the light and go, oh, problem solved. See, pain-killing medication may help you feel better, but it doesn't get to the underlying root of why you're suffering with pain in the first place. Not all, but most chronic pain in the body is coming from chronic muscle tightness. And chronic muscle tightness is coming from an irritation in the central nervous system, most usually right here in the upper neck, because inside the top two vertebrae in your neck is something called the brainstem, and there's a nuclei in there that controls most of the postural muscle tone through the body. So when you sustain an upper neck injury, and it may have been something simple in your past, and the top vertebra locked out of position, it irritates the cord and it causes a chronic muscle patterning to set up. So if you're someone who's suffering and you're sick and tired of taking medication and you're sick and tired of making Big Pharma rich, do yourself a favor, Google upper cervical chiropractor near me, get into one of the offices, get in there and find out if you have an upper cervical misalignment, and most likely it's at the root of why you're suffering.